Hello and welcome to part 3 of our lower back pain PowerPoint. So what is our method for treating back pain? So what makes me different and the people that practice in the way that I do different? So for 20 odd years, I practiced the same as everybody else. I treated them hands-on acupuncture and thought how wonderfully clever I was when I was getting success, and I did get success. I learned new techniques, new manual techniques, which again are brilliant things to learn, and I thought that was the solution. And of course, as you practice for longer and longer, you get more and more difficult customers, more difficult patients, pathologies that are more tricky to fix. And what you come to the conclusion is that the bigger reputation you get, the more difficult people you come along, and then the harder it is to fix them. And so I discovered through much research that I needed to attack the discogenic back pain problem from all areas. So that's what we're going to start to look at towards today. So the first thing is this picture here is something that I have lifted from the McGill method. It's not mine. I'm simply describing what I've been taught. If you look at the picture, this is basically what it's all about. It's all about a precise diagnosis. So we've done the have you had an assessment, have you had a case history? Okay, now we're actually getting on to the bit of are we going to start treating you? So part number 1 is we need to find you a position of respite. Can we find you somewhere to rest where your back sensitivity, your back pain calms down? So that's number 1. Number 2 is we need to practice this lovely term, spine hygiene. Can you move? Can you learn to move? Can you learn to do things in such a way that on a daily basis you are not hurting your spine? So the classic one is I get loads of people coming to me and say, oh, my back hurts so much when I wash up. And the reason being is because they're rounding themselves into flexion. So we need to teach them how to have better spine hygiene. The next one, of course, is when you're starting to get out of pain. We've already discussed how so much lower back pain is down to micro movements. Therefore, the answer is to develop the appropriate proximal stiffness. So the core stability. Its real name is proximal stiffness. Can we brace the musculature in such a way that when we do certain things, it does not hurt? Sometimes we need to introduce mobility. We'll talk more about that at a later date, but in some cases there is a mobility that we need to introduce. And then, of course, can we get back to exercise? Can we develop a new foundation for pain-free movement? Can we get back to what we were doing before, but this time can we do it better? So position number 1, position of respite. I love this term. The first thing that you have to do is stop picking the scab. And there's this wonderful picture up here of the pain pathway, someone with a sore toe. There is a direct neurological pathway from the tissue that hurts right the way up to the pain sensation. You have to stop making that sensitive. You've got to stop picking the scab. When I was a professional athlete, we were told, oh, just go through the pain. It never works. It never works. It always makes you worse. So initially, stop picking the scab. Get in your position of respite. We have to reduce sensitivity. Now, for most people with discogenic pain, the best position is lying on your stomach on the floor. You might, in some cases, introduce a little extension if you have a disc bulge. Research shows that if you have a standard disc bulge with 70% of the height of the disc remaining, that lying on your tummy, maybe on your 2 fists like this or on your face like this, that lying for 5 to 7 minutes is enough to cause the disc bulge to temporarily be reabsorbed. So that is a useful tool to have, maybe used 2, 3, 4 times a day. So more about the position of respite. So there are other circumstances where not just lying flat on your back helps, but you might also find in our bottom picture there that lying with your feet on something with your knees at right angles and your hips at right angles is also very soothing. The one thing that we need to be careful of is good old Mackenzie extension, which is there at the top. Now, The truth is that Mackenzie extension does help you reabsorb temporarily a disc bulge. But the problem is initially that might be appropriate. But if you do it for months and months and months and months and months, the likelihood is that you're just going to replace disc pain with facet joint pain. The facet joints, which will now be overloaded because of the disc pain, because they're taking up the stability, will just become red raw. And we want to avoid that as best we can. So we don't often prescribe extension. So, number 2, practice spine hygiene. It's all about ergonomics. It's all about, are you sitting properly? Are you moving properly in your daily life? Making sure that your movements don't hurt you. Making sure that your environment doesn't hurt you. Making sure that your work does not hurt you. Now, here are the things to consider. Number 1, improve your sitting posture. With ever increasingly small computers, phones, etc., and ever increasing work at the computer and phone, you have to get your posture right. Posture always matters. If you already know that, double it, because it matters that much more than you think it does. So, improve standing posture. So many people, when they're shopping, get something called mall back or shopping mall back. That is down to various reasons, but down to standing posture as well. Stop moving from the spine. The spine is your RSJ. It is not an area to be moving dramatically from. Get yourself a workstation assessment. Check that your desk is set up properly. And then learn to move from your ball and socket joints, your hips and your shoulders. That's what they're there for. Okay, number 3, develop stability, proximal stiffness. So most back pain comes from micro movements. We've said that. That's been shown scientifically. Therefore, proximal stiffness must be developed. So your core stability must be developed. Lock your spine when you move it under load. So when you are lifting something heavy out the back of the car, set your core in such a way to protect your back. Increase your back's muscular endurance, not strength, muscular endurance. Remember, core stability is what it really means is it's the front, it's the sides, and it's the back of your torso. Can we increase the strength, endurance of those areas? Can we improve the scaffolding around the structure? We want to have the ability to control flexion, lateral flexion or side bending, and extension. We don't want them moving excessively out of control. Mobility when needed. So for most people with lumbar spine, stretching is not encouraged. We've said in previous videos that stretching causes a stretch reflex and that in the long term can make you worse. However, because of the way the thoracic spine is and the way that we live, most people end up very stiff through the thoracic spine, and then their lumbar and their cervical spine have to do more work. So often stretching the thoracic spine into extension is recommended for most people, but that is person specific and needs to be tested. What we do recommend is stretching the hips and the shoulders, because we don't want leakage from the hips, because the hips can't do something, into the lower back. So stretching the lower back and hips, stretching the hips and the shoulders is recommended. Don't stretch your lower back. Okay, finally, number 5, develop a new foundation for pain-free movement. So for many people, that's getting back to their sport, but doing it in a way that they're better this time, so they're not going to hurt themselves again. Perfect technique. The goal is to get pain-free movement back into your life. The idea is to have reduced your chances of further injury, and we use exercise therapy and treatment to build your capacity. So we start with pain-free movements, and over time we expand your library of pain-free movements to the point where hopefully you're so conditioned that you don't have pain or lower back pain for your lifestyle. That's where we're at. Look forward to seeing you in the next chapter. Hopefully we can continue to help you.